Ioannidis, professor at Stanford, he has written a widely accepted peer-reviewed study on the infection fatality rate of COVID. And at the time, Jay Bhattacharya and John Ioannidis at Stanford, they were publishing these studies showing an infection fatality rate of 0.035% in the non-elderly population, 0 to 59. And then when you go by age, if you go by 20 to 29, it was 0.003%. If you go to people in their 30s, it was 0.011%. And you put that against a 1 in 800 serious adverse event rate, according to the best data, it did not make sense. Like, you weren't saving lives by giving it to healthy people.
Again,
right?
if
you look at immunocompromised people and people with multiple comorbidities, it's a different situation. But for healthy and particularly young people, there was no clear benefit of vaccinating, and there was an abnormally high rate of risk.
Do people who are healthy interact with people with comorbidities and who are immunocompromised?
Yes, but the vaccines didn't stop the spread. We've already been over this.
The vaccines stop the spread initially and then minimize the spread. And what you're saying what you're saying,
then it went to zero in a couple months.
Every country in the world was stupid.
Most countries in the world did not have sensible COVID policies. If people listen to Jay Bhattacharya and Martin Koldorf, who you said you like, by the way, we would have had very different policies.
I don't necessarily agree with everything, but I like them.
Okay. Yeah. And so, particularly for young people, there was the risk of myocarditis.
Rob, you just said that pretty much every country in the world wasn't sensible.
Do you have any mistakes science has made in the past?
Okay. When everybody's making the same mistake.
Some countries did it better. Sweden did it better. Finland did it better. Denmark did it better.
We talked about that. You notice that they're grouped together there. But okay. But when everybody else, look, it's fine. We'll disagree on this, and we'll let again, I haven't looked at it in a long time, and you obviously spent a lot more time with it than I have since I had to deal with it with the Mavs, right? But at the same time, I listen to everybody who had exact opposite positions that you do. And
yes, and I listen to those people too. And people like Peter Hotez, Eric Topa, I listened to them, Nicholas Christakis. I was reading all their work. Jay Bhattacharya was far more correct, and Martin Koldorf.
You determined that Jay was more correct. I determined the NBA.
And many other people.
Right,
yeah.
And the NBA and myself and others came to the opposite conclusion. That's just the way it is, right? That's the way science works.
Sure. But if you spoke to Jay in September and October, I bet you might have made a different decision on mandating it for your staff.
Probably not.
Probably not?
Probably not.
By the way, when I spoke to Jay, I had no anti-vax, no pro-vax. I'm like, hey, tell him, like, I'm curious about this. I'm learning this for the first time. Spoke to Tracy. I spoke to Peter Hotez online. Many other people pro-vaccine and anti-COVID vaccine. And then I came to my own conclusion. I bet if you'd spoken to Jay, you would have not mandated it for your players.
Probably not, but you never know, because it's all hypothetical.
And again, your criticisms against Joe Rogan, again, he said young, healthy people they don't need the vaccine.
I disagree.
Turns out he was right.
No,
for young, healthy people.
Again, you look at it as an individual person, and that's where we disagree. And then you say that the vaccine did prevent communication with transmission, which suggests that there's no reason to take the vaccine at all, and except for your own personal protection, because there's nothing you could do to even minimize the risk of transmission. There's a lot of people who disagree with you on that.
Yeah, you were minimizing transmission for a couple of months, and then you weren't.
Again, we went to having tests, but at the same time, anything I could do to reduce the number of hospitalizations and deaths, and every bit of data that I could find around the world, including Israel and Qatar, when they published all their data, confirmed the exact same thing. The more vaccinated the population, the fewer the deaths and hospitalization. That has never been in doubt anywhere. Would you agree with that?
Yeah, except there's so many confounders to observational data, as you would well know.
Even within you take whatever confounders you want.
The healthy vaccine user bias was a big part of why you were seeing disparities in health outcomes. Vaccinated people on baseline are much healthier than unvaccinated people. Right?
Yeah, and that says a lot in a lot of ways, but and suggests a lot of things, but at the same time, there hasn't been. I'm gonna stick to my guns. And
all right.
Every bit of data that I've seen and everything that I've read said if you're unvaccinated regardless, healthy or otherwise, relatively speaking, on an index, your risk is for hospitalization and death is dramatically higher.
But that's absolute versus relative risk reduction. If my risk right now talking to you is much lower of dying than of being on the highway right now. Does that mean I don't drive on the highway right now?
Yeah, but no, come on. Being on a highway is not a communicable disease. There's not transmissible.
Okay, we're just talking about relative risk. Yes, of course. Yes, I know it's not a perfect comparison, but the survival rate for COVID for the non-elderly population, I pulled up these numbers again for my articles. It was 99.965% for people 0 to 59. And the people that did die of COVID and were hospitalized, they were almost entirely the ones with multiple comorbidities, had obesity.
And what percentage let me ask a different question to put it a different way. What percentage of people, any age for that matter, have comorbidities and don't know it?
What percentage of, say it again?
What percentage of people have comorbidities and don't know it?
I don't know.
I don't know the exact percentage, but it's certainly far greater than zero. I had AFib. I just had an ablation, right? So you can tell your cardiologist about, I had a PFA and so far so good. But most people, I didn't know I had AFib forever until I drank too many drinks, energy drinks, right? And then it kicked in and I was like, oh, what the fuck is this? But I had no idea. My uncle had no idea. There's people who fall over and have strokes. I know several people who had strokes that ended up because of AFib that they didn't know they had. And so it's a comorbidity that as you get older, and I'm not talking 60, I'm talking 30, that there's a lot of shit you don't know you have. There are people who fall over dead with, thickened walls of their atria, whatever, right? And so it's hard to distinguish. It's hard to do a risk analysis because that's what you're trying to do. You're trying to do a risk analysis, right? You're trying to say that the risk level is greater for a vaccinated kid who's healthy than someone who's not. But it's impossible to discern who is completely healthy and who is not. It's impossible. People don't even know it about themselves.
But there are some good indicators that show that.
No, there's no way to know. That's why nobody dies healthy, right? We all have something. And there's a lot of people who die before they should because of the some things they don't know. You maybe have read about all the women now who are finding out that they have cancer and the numbers of cancers in kids. How old are you, Rav?
24.
Okay. The number of cancers in kids, in your age group is skyrocketing. And there's no proactive tests to know. None.
Yeah. Some people attribute it to environment, toxins, diet, mRNA vaccines. Some people.
Well, I don't know about mRNA. Yeah. I don't know about the vaccines. But whatever you attributed towards, right? You don't know. The individual doesn't know. Yeah. And so when you put your co-founder as having all these comorbidities, not having comorbidities, it's hard to know.
Sure, but that doesn't mean you take an experimental gene therapy that's been rushed through emergency use authorization. That doesn't mean that.
Okay, RFK Jr.
Okay. The study, you can read it by Freeman and colleagues. I'll email it to you. Okay. And last thing on that, that's on the 1-800 serious adverse events. Okay. Other vaccines on the market, which some people also dispute, but putting that aside, are serious adverse event rates of 1 per million or 1 in 100,000, 1 in 500,000. Other vaccines, like the swine flu vaccine, it was withdrawn in 1976 because of a 1 per 100,000 rate of Guillain-Barré syndrome. And other vaccines have been pulled for far lower rates of serious adverse events. But this one is showing 1 in 800. And the study authors, they said this is the first and only rock solid paper reanalyzing Pfizer and Moderna's own clinical trials. Okay.
So, but those clinical trials occurred prior to the first instance of COVID, right? The first, the pre-mutations.
Yes, very likely. Okay. Yeah.
So it's not really applicable to anything post that, right?
Well, but yeah, I mean, there's so many other factors, including the serious adverse. Yeah, what the long-term effects of the vaccine? I mean, that's also another question.
Does it use VAERS? Or no, you said it used their own data. Okay.
Yeah, and the study found that the excess risks of adverse events of special interest exceeded the reduction
Okay.
in COVID-19 hospitalizations in both Pfizer and Moderna
Okay, you can
trials.
send it to me. I'm happy to look at it.
You,
And
you
then
yeah,
what I do is I put in the name of the study and ask for people who disagree with it, and then I'll read both sides.
Sure, yeah. But your attack, when you attack Joe Rogan, you mentioned the community benefit. You want to protect grandma, which I think is totally ludicrous and doesn't
No, are
make
you
sense.
kidding
But
me? Then that's part of being 24 years old, right? Because you worry about yourself, and
no,
it's not.
grandma can
I'm
get the
not talking about
vaccine.
grandma that you don't know. I'm talking about grandma in your own household.
Yeah,
Grandma
she got
that
the vaccine. My grandma got the vaccine.
Okay.
So
So hopefully she's fine, but you still take that
she is
risk. Or
fine.
the grandmas, that maybe it's not that you come in close contact with, that maybe that they live in the household where taking the vaccine was frowned upon. Maybe, maybe they're an anti-vax family and you don't know it.
Okay, but if I had gotten the vaccine, I still would have gotten COVID, and I still could have passed it on to grandma.
But the chances, all the numbers are reduced.
For 1 or 2 months, they're reduced, and then after that, I can still pass it on to grandma.
Okay.
So
if it's 1 day, if it's 10 days, right? Then if you're reducing the death count, that's a positive.
But grandma's going to get COVID anyways, and she did.
Grandma won't necessarily get COVID. Grandma, whatever, right? We're going to go around in circles. But I get
people were going to get COVID regardless of their vaccination status. You know this.
Yeah, not necessarily, but you can still be vaccinated and still get COVID. Yes.
Yeah, most people who got vaccinated also got COVID. Some estimates show it's like 99%. Like
it's not 99%.
Pretty much
no, it's not 99%.
Pretty much everyone, unless you're inside all day, you're not in contact with other people, you're in complete lockdown mode in 2025. You likely got COVID at some
not
point.
Not necessarily, but in any event.
Yeah, but putting aside the community benefit, though, if we just caveat that, would you still have attacked Joe Rogan for saying young people should not get vaccinated? Like, do you think for young people there was a clear benefit, putting aside protecting grandma?
Yes, absolutely.
You still think there was a clear benefit?
Yeah, based off of what I see here, and based off of the fact that you're only giving one side of the story and not saying here's the other side. But yeah, right. So we'll let ChatGPT would have criticized Joe Rogan because ChatGPT says it's a greater risk.